So Nemours Children's Clinic in Jacksonville is a full-service, multi-specialty pediatric clinic that is part of our national organization that includes AI DuPont Hospital in Delaware and Nemours Children's Hospital in Florida. Nemours in Jacksonville is the only multi-specialty center, and Wolfson Children's Hospital is the only tertiary referral children's hospital in all of Northeast Florida and Southern Georgia. So we have a very large catchment area and do all of the pediatric orthopedic care in the region. We offer one position in Jacksonville for the Pediatric Orthopedic Fellowship that covers all aspects of pediatric orthopedic care, including trauma, limb deformity, scoliosis, hip deformity, clubfoot, etc. We have 5 or 6 faculty at a time, and our fellow gets to develop close personal relationships with those faculty and be exposed to all areas of pediatric orthopedic care. The fellow could expect to rotate with each faculty member at the beginning of the year for about a month at a time so that they get exposed to everything. And then toward the end of the year, we do sort of a choose your own fellowship theme where the fellow can focus on areas of interest. We have a strong academic program at our fellowship. We also teach residents from the local University of Florida program and from the Mayo Clinic, but we only have one fellow. We typically meet every morning to round on our patients and do some kind of academic activity. We have multiple conferences, including preoperative conferences, postoperative conferences, journal clubs. We collaborate with other services like our physical medicine and rehab doctors for special needs children, and our neurosurgeons for complex spine cases, and our endocrinologists for bone mineral disease. Our fellow can expect to work every day closely with our staff in the clinic or in the operating room. Our fellow can expect to do somewhere between 250 and 350 cases per year, which is a decent amount of experience. Our fellow does take call in our system. What we usually do is we start our fellow off in the resident call schedule so that they learn the lay of the land and how we manage patients in our emergency department and in the operating rooms. Once the fellow is comfortable, we transition them to the attending call schedule with full privileges at Wolfson Children's Hospital, where they can help teach residents and where they can manage some patients on their own with appropriate backup from our staff. The ideal candidate for our fellowship is someone who wants to work in a busy environment and get exposed to all areas of pediatric orthopedic care so that they can take care of any problems that they see in private practice, whether that is a future subspecialty interest or whether that is as a general pediatric orthopedic surgeon. At Nemours and Wolfson Children's Hospital, we utilize all the latest technologies, including spine navigation, metacasting for infantile scoliosis, complex hip deformities, and complex limb deformities, including magnetic growing rods and magnetic intramedullary nails. We treat the full spectrum of pediatric orthopedic disease, including all of the interesting rare conditions. And so when a fellow finishes our program, they should feel comfortable taking care of all pediatric orthopedic conditions. Nemours is a mission-based organization, and so we treat all patients regardless of their ability to pay. And that allows us to see patients from all socioeconomic levels and to be able to help them without regard to their insurance or ability to reimburse us. So at Nemours, we have multiple service lines that cover all areas of pediatric orthopedics, including a sports medicine service line, a spine service line, a clubfoot service line, a hip dysplasia service line, a limb deformity service line, and we have excellent support staff. So in addition to our pediatric orthopedic surgeons, we have multiple medical assistants, nurses, PAs, nurse practitioners, and CAS techs that all work together to provide the best care we can for our children. One of the great things about our fellowship program at Nemours is that there's only one fellow. And though we teach residents, we give priority to our fellow. So if there are interesting or rare cases that the fellow is interested in, we can always work out the fellow being involved in those cases. Another great thing about our fellowship is that there is a Mayo Clinic in Jacksonville, Florida. and we collaborate with a couple of their orthopedic surgeons who help provide specialized care at Nemours and at Wilson Children's Hospital, including oncology cases and brachial plexus pathology. Jacksonville, Florida is a great place to spend a year during fellowship. The people are friendly. The weather is temperate, so we can do outdoor activities year-round. We are close to beaches. We are close to resorts and theme parks. We have great cultural offerings, including a professional football team. Thank you for taking the time to learn more about our fellowship program. We really look forward to meeting you. We wish we could do it in person, but these are obviously unusual times this year. But we look forward to seeing you virtually and showing you more about all that our program has to offer.